Good morning, and thank you for joining us for the August 26th COVID-19 virtual news conference. My name is Mariah Miracle, and I'm a public information officer working in the Humboldt County Joint Information Center. I'd like to introduce today's panelists: Humboldt County Public Health Director Sofia Pereira, Registered Nurse and Communicable Disease Program Supervisor Hava Phillips, Registered Nurse and COVID-19 Vaccination Coordinator Kathryn O'Malley, and County Health Officer Dr. Ian Hoffman. I'll start today with a brief update from the Joint Information Center before we hear from our panelists. A total of 6,741 Humboldt County residents have tested positive for COVID-19 as of yesterday. More than 1,600 cases have been reported in August alone. That's the highest to date, topping monthly case counts during the winter surge in December and January. The county has reported 80 additional COVID hospitalizations this month. And in that time, 12 county residents have died as a result of COVID-19. As always, anyone with questions about vaccination, testing, or safety measures can reach out to the community information line at 707-441-5000. We take calls in English and Spanish, Monday through Friday from 8 to 5. Now let's hear from our panelists. We'll start with Public Health Director Sofia Pereira.
Good morning, everyone. First of all, I just want to really express my gratitude for Hava and Kathryn joining us this morning. They're both incredibly busy working and leading our teams on contact investigations and our vaccination efforts. So really, really honored that they were able to join us today to share their expertise with the community. They really represent a brilliant, dedicated, and tireless team of public health staff that really have been working nonstop since the very beginning to protect our community. They represent the effort that it's going to take for this entire community to get through this pandemic. And we know where we're at right now. It is the worst that has been since we got that first case about a year and a half ago. And with the rise of hospitalizations locally, we are working very closely with our hospital partners to ensure that they have the resources that they need to provide care to those who need it most. And as we know, there are staffing shortages across the state. This is a very dire situation, but we are as committed as ever to get through this. And while we at Public Health are doing everything we can, it's going to take all of our community partners, community organizations, local business community, our neighbors, keep our neighbors and loved ones safe. And so please, please continue to take the safety precautions that are gonna get us through this. Distance, wear your mask, and get vaccinated. And I'm gonna turn it over to our team for the other updates. Thank you.
Thank you. Hava, can you share an update?
Yeah, absolutely. My name is Hava Phillips, and I supervise the Communicable Disease Program at Public Health. And so that includes the COVID investigations unit on kind of a larger picture scale, while my amazing colleague Angela supervises that unit on a more day-to-day activity basis. So our program right now is, as Sofia said, seeing extremely high case rates. And at the same time, we are also losing a lot of our state redirected staff that have been doing contact tracing for us for quite some time, as their programs need them back, which is absolutely a reasonable thing as well. And to try to manage that, we are working to use our state contact tracing software to automate as much of our data management as we possibly can. And we are continuously looking for ways to make our investigations more efficient as we go. But we already know that when disease is this widespread in the community, the way that Humboldt County right now it is actually going to be able to do the most good is by vaccination rather than contact tracing. When there is widespread transmission, vaccination is really what prevents disease and death most effectively. So my program doesn't handle vaccinations, but the two are really, really closely linked. Data from the New York Times a couple of weeks ago showed that in California, unvaccinated people are about 68 times more likely to be hospitalized with COVID than vaccinated people, and 58 times more likely to die. And state and local data bear those trends out as well. State data also shows that the vast majority of all cases are in people who are not vaccinated, and while people over 65 represent the smallest number of cases of any age group, they also represent the largest number both of hospitalizations and of deaths. which means that our elders are relying on those of us under 65 to protect them. And so for my program, for the county's contact tracing efforts, the one thing that is going to have the greatest impact on reducing COVID-19 cases in Humboldt, and the thing that is going to keep people from ending up in the hospital and save lives, is for each person in Humboldt who can be to be vaccinated, including the people who are young and healthy and not likely to get particularly sick themselves. Because unfortunately, with this level of disease transmission, contact tracing is not enough.
Thank you, Hava. Kathryn, can you share an update?
Sure. My name is Kathryn O'Malley, and I'm a supervising public health nurse here for Humboldt County. And I'm currently working as the COVID vaccination coordinator for our operations unit here for the department. And right now, 52% of Humboldt County residents are fully vaccinated, and that's our goal, is really the fully vaccinated. My job is to try to schedule clinics wherever we can. We are going sometimes 3 and 4 sites during the day. We have 2 mobile teams that are going out and providing clinics. I want to thank media and the Joint Information Center for putting out all the information about where our clinics are going to be. We're doing our best at trying to bring vaccine to the people. We really try to pinpoint which areas we are needing to target based on low vaccine rates, based on target populations that are more at risk. So we really try, I call it the game of Stratego, because it's trying to find out where we can go next and set up a team. I want to thank our community partners that have helped host us at various locations, and business partners that have hosted us at various locations. It's been very successful for us. And we continue to try to guess where our next place to be and where we can go to vaccinate people and get the best input and uptake of vaccines. We've tried lots of different methods. Really, it's the number one thing that we know that's going to prevent severe illness and hospitalizations and deaths. And so it's been our goal all along to bring vaccinations to the people. We are also doing vaccinations of homebound. So if an individual indicates that they cannot get out to a vaccination site or a clinic, we bring the vaccine to them. And so we have been doing that as well. So, continued, as everyone's saying, that we just really need to, vaccinations right now is our best tool in this arsenal. And we just need to, we're going to be continuing to do it. It's a changing landscape every day, and we're going to continue to offer. Thanks.
Thank you, Kathryn. Dr. Hoffman?
Thanks, Mariah, and thanks, everyone. I want to echo Sofia's statements. These are incredibly hardworking teams in investigations, vaccine, and also our public-facing JIC staff who, really put that message out there about everything that we do here. So thank you all for everything you're doing for this public health effort. So we know this is a very difficult time, and Sofia mentioned this is the worst it's been for Humboldt County. And that's true of many of the northern counties currently. We know our neighbors just to the north in Del Norte are suffering much more than even we are here. This is really about vaccination, as we've all mentioned. The vaccination rates are directly proportional currently to what communities are experiencing. So the lower the vaccination rate, the worse they're experiencing this Delta surge. The vaccine is working in those communities to prevent hospitalization, severe disease, and death. And the vaccine is widely available. As Kathryn mentioned, we are going out to places every day, multiple times a day. It's available in pharmacies, at many doctors' offices. So we will continue to make it available to those who seek it out and break down those barriers for those who are still looking to get vaccinated. There is some maybe hopeful evidence that we're starting to see the peak of this current surge with our latest numbers from the last week that showed our case counts in the unvaccinated population were plateauing at extraordinarily high rates of over 70 per 100,000. And then in the unvaccinated, or in the fully vaccinated group, that our case rates are actually going down for the first time since the Delta surge started. We believe that is likely due to folks in the fully vaccinated taking more precautions with masking and distancing and doing the things that they need to do to protect themselves. And as far as hospitalizations, we have continued to see locally the data reflect what we know nationally and statewide, which is that hospitalizations are, the vast majority are the unvaccinated, and that those who are fully vaccinated and hospitalized are older and have pre-existing conditions that predispose them to to severe disease with COVID, even if you're fully vaccinated. So definitely encourage everyone who fits into the current recommendation for a third booster shot to go get one. So anyone who fits those immunocompromised states, please go get your booster now, because those are the folks we're seeing who are getting hospitalized and unfortunately some dying. But very few, I should point out. And also that, if you are one of those folks who are immunocompromised or at higher risk, whether you're vaccinated or not, please take more precautions. Consider staying away from large events, family gatherings, places where you might be exposed, using more distance, masking more often than you would otherwise. Locally, the numbers we're seeing in the hospital for that group of fully vaccinated is that they are really, the average is well over the age of 70. And that, I think when we're seeing these numbers lately of people being hospitalized 20, age 30, age 40, all of those folks are unvaccinated. This is really being driven. The hospitalization currently is again, it's all preventable with the vaccine. Those folks, if they were vaccinated, would very, very unlikely to be hospitalized currently. Lastly, I'll just mention CDC just sent out an alert about ivermectin, which is a unapproved treatment for COVID-19, and want to alert the community that if you're hearing things about ivermectin being good for treating COVID, this is not a recommended treatment. It's well proven that it doesn't do anything to prevent severe outcomes or hospitalization with COVID-19, and it is potentially very dangerous. So the CDC is trying to get that word out. There's massive increase in the use of ivermectin across the country right now with this current surge. So please seek out better resources, seek out verified treatments from your healthcare providers, and please get vaccinated. Thank you.
Thank you, Dr. Hoffman, and thanks to all of our panelists. Now we'll take questions from reporters. Let's start with Thad Greenson from the North Coast Journal.
Thanks, Mariah. Dr. Hoffman, I'm hoping you can tell us just a little bit about modeling and what your expectation is of hospital capacity over the next couple of weeks. I know you mentioned that there's some indication of a plateau, but as you've said before, hospitalizations trail a couple of weeks behind cases, and from all indications, the hospitals are already very impacted. So can you just kind of forecast what you're expecting to see over the next 2 or 3 weeks?
Yeah, so that plateau was hopeful that we maybe won't see continued rise in the hospitalizations. And I think also a little too early to say for sure, but I think that we're seeing a little dip in those fully vaccinated folks who were getting hospitalized earlier on. I think, everyone's just taken this a lot more seriously, backed off of some of those earlier recommendations that maybe if you're fully vaccinated, you don't have to wear a mask anymore, that you don't have to be as cautious. So I think that word has gotten out. So the numbers in that group also look like they're going down for the hospitalized, fully vaccinated folks. And, we did get a resource request for nursing staff from the state recently. So that should be helping out the hospital. Whether or not we see an increase above, we kind of seem to be peaking out around 30 to 33 hospitalizations currently. That was about where the modeling put us a few weeks back. And so I think given that the case counts seem to be holding stable now, unless there's some other large change, I think we'll be in good shape more than likely. So it all, though, comes down to human behavior, as we all know, which is sometimes very unpredictable. So I think if people do heed the warnings, wear a mask, avoid gatherings, really try to revert to some of those behaviors that we had a year ago, we'll see this wave, go by and, hopefully be able to increase vaccination rates going into the fall to really prevent this from happening again.
Excellent, thank you. And I guess just a quick follow-up is, obviously most Humboldt County schools are returning to in-person instruction this week and next. Do you anticipate that impacting case numbers and the surge?
Absolutely. I think we will definitely see an increase in cases from the schools. A lot of that is going to be low impact disease because a lot of these are kids who, well, I should say almost all of these are going to be kids who are getting it outside of school. We really haven't seen any in-school transmission across the state. That's holding true already for schools who've been in session for a week or two. Places where masking is required, we're not seeing in-school transmission. And so that's true across the entire state of California, obviously here in Humboldt County as well. So I think we'll see an increase in cases potentially from that, just from identifying cases and trying to isolate those kids who were infected outside of the school from any potential spread within the school. I hope that will not really relay into an increase in hospitalizations, as we will be able to isolate those kids, identify them quickly and isolate them, and keep schools open and keep schools running. So that's definitely, that's what we're hearing from the folks who've already been open across the state, is that slight increase in cases in that age group, but not really a big impact otherwise.
Excellent, thank you. And just to clarify real quickly that I understood that correctly, I mean, so you're essentially saying that you anticipate more identified cases, but not necessarily schools being back in session leading to more disease transmission locally.
Yes, that's correct. I think we will identify more of those kids who, over the summer might not have been as identified because they wouldn't have been in a setting where we are protecting the rest of the population more. So, that's a good thing. That means if we identify them and isolate them from the schools, we're going to keep those other kids protected, keep those schools open, those classrooms open, and definitely slow the transmission across the board. But I do think it could lead to a slight increase in the coming weeks just due to that identification.
All right, thanks very much.
Thank you, Thad. Any other follow-ups on those topics? Hospital capacity, school reopenings. All right, we'll move on to Isabella Vanderheiden from the Times Standard.
Hi, thank you. On Wednesday, the Joint Information Center reported the first death of a person in their 20s, as well as the first death of a fully vaccinated individual in their 70s. Can more details be provided about either patient, and were there any pre-existing conditions?
Yeah, we don't want to comment on specific cases. I think what I will comment on is the general trends, though, which is that, again, those fully vaccinated members of our community who are getting hospitalized are older and they have multiple pre-existing conditions that predispose them to severe COVID. And those trends that we're seeing across the country and across the state in larger aggregate numbers. We only have a couple here, so it's we don't tend to report out on just one or two cases, but that the cases we are seeing here are very much reflective of that aggregate data at the statewide level. That again, people who are dying, people who are getting hospitalized who are fully vaccinated are an older group, usually in their 70s or older, and that they have multiple pre-existing conditions that predispose them to hospitalization or death. And so again, that's why I really want to encourage those folks right now, and those are a lot of the folks who are eligible to get the booster immediately. They could get that booster now to help their immune system and in case they get exposed to COVID. As for the younger group that is getting hospitalized right now, here's what I'll say. Some of these pre-existing conditions that we're talking about, the comorbidities, are much more common than you would think. So some people, we're seeing hospitalized or younger folks dying. You might not look at them and say that person is unhealthy. We have to remember that some of the conditions that predispose people to more severe disease are common in 50% or more of our population. Things like hypertension, things like diabetes, things like obesity, things like asthma, right? These are very common conditions that we see in a lot of people. And so those younger folks with those certainly are the ones we're seeing in the hospital more frequently, but they're not necessarily people you would consider extraordinarily unhealthy. They are members of our society who are your friends, they're your family. And, I'd say it's unexpected, almost all of these young folks who are both hospitalized and dying from this disease. It's not expected that they would die from this disease.
Thank you for touching on that.
All right, Hank Sims from the Lost Coast Outpost.
Hi. Well, I'm not sure who can speak to this, but on Monday, in your daily release of statistics on COVID cases in Humboldt County, you said the Joint Information Center said that you were not able to verify or to count all the cases that came in over the weekend. That there were at least 100 and some, and that there were likely many more, I think was the language that you used, and those would be added throughout the rest of the week. And I guess from a lay perspective, I would think that these are being downloaded from the CalReady database, and it would seem that it would be just a press of a button kind of thing. But I gather that it's a very laborious procedure, and just in the interest of being clear with our readers about how accurate those numbers are and what is missing. Could you talk a little bit about why this is such a laborious procedure to compile the statistics that you release every day?
Let's see, Hava, do you want to kick it off? And I don't know, Dr. Hoffman, if you have anything to add.
Sure, I would be happy to give that a shot. So it is, as you said, it does come out of CalReady and it does get reported, but there are a number of points in there where each case needs to make human contact in order to make sure that our data is as accurate as it possibly can be. We deal with a whole lot of different variables. Each investigator entering data into one system creates a variable and a point of fact checking. Each laboratory reporting into CalReady creates a different variable and a point of fact checking. And the way those two systems communicate with each other creates a third variable, point of fact checking. And so our data team locally is looking to make sure that all data at all of those points is correct, that we're not, for example, double counting cases. If a person is reported with a lab result and, their name is spelled slightly differently one way, and so it goes in as two cases when it should really be one. The data does move quickly, but getting it clean enough to report out is the process that really takes time.
Yeah, thanks, Hava. And I would just add to that. So the systems that we're using for this, have never been used for this level of disease in the past. We really use this for diseases that are prevalent, but not so common like COVID is. And we've never lived through a pandemic. So, we're all just doing our best to try to keep it up. And as Hava said, we want to make sure the data is sound data before we put it out to the public. So it does go through an actual person's hands. We are looking to continuously automate as much of this as possible. And so, now given the very high numbers, we are moving towards more automation, but that, will lead to less accuracy. But I think, what we've really come to acknowledge is that accuracy isn't as important as it was when we only had 5, 10, 15 cases a day. And now we have hundreds of cases a day. So we are moving in that direction. And that's why you saw that switch this week. We're moving away from accuracy to expediency.
Great, thank you.
Thank you, Hank. Ryan Hudson, redheaded black belt. Ryan, do you have any questions?
Thank you.
We can hear you now.
Okay, I would like to start with maybe Dr. Hoffman can answer this one. Recently, many caregivers who are tasked with, caring for severely ill COVID patients as we speak actually are expressing frustration with the lack of planning and, regarding the surge, they have not been made aware of any emergency operations plan or anything to address what they kind of are describing as crisis mode. So I'm wondering, has St. Joe's Hospital provided an emergency operations plan or a step-down plan or anything of that nature to the county or state Department of Public Health in regard to the pandemic?
Yeah, thanks, Ryan. That's a great question. So from the beginning, St. Joe's Providence had a surge plan in place that was worked on before I was health officer with the previous health officers, but it was a plan that was really designed to handle even more than what we're seeing currently. Because remember, when we were worried about the first surge, it was before there was a vaccine and before we had given even the first dose to the first person in our country or our county. So we had not only an ability to surge to, as much as 80 beds in St. Joe's Hospital, but 100 bed alternate care site at Redwood Acres that could have held another lower acuity 100 people. So this surge plan has been there. We decided to demobilize the ACS due to predictions around future surges and vaccination rates. And we felt confident that we would not need it, that we could handle that, potential 80 bed surge in the hospital. So that surge plan then went back to just utilizing the existing hospital, not the ACS. And that's the surge plan that's in place currently. The capacity is still there to take care of more people in our county in terms of the actual physical space and the physical numbers of beds, but the problem is those beds need staff. And in the meantime, since all of this started back in 18 months ago, we've seen dramatic decreases in nursing staff across the country. Many have retired due to the stress of this pandemic, the extraordinarily high toll it takes to take care of COVID patients has forced early retirement in many nurses. And then on top of that, we've seen a lot of nurses leave their full-time positions at a local hospital to take much more lucrative contracts traveling around the country, taking care of COVID patients because they can get paid quite a bit more for that. So the pool of nurses are way down locally and nationally. And so with this current surge, given the numbers that we're seeing in other places in the country, we're competing against not just our local counties who are surging worse than us, like Del Norte. And in fact, if we look at the northern counties, we're actually surging the least of all of them in terms of hospital beds. Mendocino, Lake County all have worse hospital situations than us. We were finally able to this week secure extra nursing staff. So I do think that the capacity is here, the surge plan is in place, and but when you have this many patients all at once across a county, it's not gonna, there's no plan that can plan adequately for that. It's a difficult job, and it's one that we don't want to be in. And it was preventable because vaccination would have prevented this.
Thank you. I really appreciate that answer. If I could also just ask about the current ICU capacity and just check in on that while I'm at it.
Yeah, so with the addition of these extra nurses that are coming on board, we will have an expanded ICU capacity. So that should hopefully help with the current situation and potentially allow more folks to stay in county and not have to be sent out. We currently have 6 people hospitalized out of the county who, had there been beds here for them, we could have kept them in Humboldt County. Some of them, not all, I shouldn't say all of them. A few of them were people that needed higher level of care than what we could provide here in Humboldt County. But certainly there are people we've been sending out for weeks now that had an acuity that we could have taken care of here, but we just didn't have a bed for them. So I think that should get better. So there's also some ER staffing that's coming to help out. These are not tremendous numbers, but they should alleviate a little bit and allow them to continue to take care of the folks in our community. But people do need to be patient. I mean, you're going to wait longer than you would normally. The impacts are severe. We're going to ask people who are lower acuity to stay home. So we have bed space and nurses and doctors available for those who are the sickest. And, another reminder that this impacts not just COVID, but everyone in our community. We're seeing delays in surgeries that are, really needed. They're not emergency surgeries. Any emergency is going to still be taken care of, but, these are things like that really it's again, preventable. Could we have less hospitalizations overall? We'd be able to do these surgeries that people who've been waiting for a long time for them. So it has impacts across the board. And so staying home, wearing a mask, and getting vaccinated are all things you can do to help decrease the surge in the hospitals and take the load off of this very taxed healthcare team right now in our county.
Thank you.
Thanks, Ryan. Now we'll go back to Thad from the Journal.
Thank you, Mariah. I have a quick follow-up to Ryan's question and then another question. But I'm curious, Dr. Hoffman, can you give any more specific information about this nursing team that's coming in, or the added ER staff? Just how many people we're talking about?
Sophia, I don't know. Are we at liberty to discuss that more? And I don't.
Yeah, I think it would be premature.
Yeah, I think it's more.
I think still confirmed with the state some of the details.
It's really a contract between St. Joe's and the state, so it'd be a better follow-up for St. Joe's, and it's, I don't think, completely actualized yet. So you might want to check in a couple of days with them and see. But I'm sure that they'd be happy to share the details once they have everything finally secured.
Okay, understood.
But what I can say about it is that the need is tremendous in healthcare right now. I mean, just across the board, and the number of staff that they need is, I mean, it's just unbelievable. Like, and it's not just nurses and doctors. We're talking about loss of people in, the environmental services part of the hospital, radiology, not enough staffing in the food services. I mean, it just is across the board. People have left healthcare because the environment is stressful, and some people just don't feel like it's worth it anymore to continue this level of stress under the circumstances. So they've worked very hard trying to find staffing from places all across the country, and just one closed door after another, because every hospital across the country is in the same position.
Okay, thank you. And then my other question was for Ms. Phillips. I feel like we've transitioned, as you said, kind of in your openings, from a period where contact tracing was one of the key tools in the toolbox, so to speak, to prevent this type of surge we're seeing right now. And with the hope that we'd develop an effective vaccine. Now we've got that effective vaccine and we're in the midst of the surge. And I'm just wondering if you can talk a little bit about how you and your staff are holding up, given this kind of paradigm shift, now 18 months into this pandemic and things looking worse than they ever have locally.
As Ian and Sofia both said, my team has worked incredibly hard from day one. I have an amazing team of people, and have from the very beginning, people whose job this was originally, people who had entirely different jobs in the county and got pulled into this and have stayed and been dedicated, people who don't even live in this county and have worked long hours to protect our community. We've had a tremendous number of just genuinely dedicated people doing this. And one of the things that fuels that kind of dedication and that willingness to put in that degree of effort is a genuine concern for the community and a genuine interest in the health of the people that we're serving. And so when that is your motivator, it is very difficult to watch what's happening now happen. So I would say that this has absolutely taken an emotional toll on my team, and continues to, and they remain dedicated to making the most difference they can where it matters most. But please get vaccinated.
Thank you.
Thanks, Thad. Isabella from the Time Standard.
Yeah, thank you. Can Dr. Hoffman explain the difference between getting a booster shot and getting a third shot? And also, does the county know, if any, how many people thus far have received a third shot, whether it's a booster or something to help the immunocompromised?
Yeah, I think it's a good question. We're still working out the terminology here. I think what the difference between what we might call a third shot in a series versus a booster shot would be the difference between a requirement and a recommendation. So I don't know that there's any final determination of whether a third shot is absolutely a requirement. What I'm hearing is it's probably not. It's probably just going to be a recommendation. Currently, for the immunocompromised that we're talking about that are currently eligible and encouraged to get a vaccine, now it is a strong recommendation. It's not a requirement for them as as a fully vaccinated individual. So that's kind of the difference. And I think we're still, honestly, still working the language out around how we talk about these third doses. And, that'll probably become more clear in the coming weeks as we get guidance from the Biden administration about what their plan is for a third dose for a larger segment of the population.
Great, thank you.
And then Kathryn, I don't know, I mean, we have been giving third doses in our clinics. So Kathryn might have some specifics on those numbers through public health. I'd say, though, we are not doing the vast majority of the vaccination in the community. So we should start to see some numbers from the other folks as we see those come in. And I know My Turn in Care should be able to give us that data, but it's all pretty new. So I don't have any specifics for the county as a whole. But Kathryn, do you have?
I don't have specifics on how many third doses we've given, although we're referring to it as an additional dose. For those that are immunocompromised would be an additional dose. There's a lot to it because the announcement comes out and then our database didn't have the ability to capture that dose yet. So we had to catch up with like, okay, and that came from the state. So that's not our database, that's the state's database. And they said, yes, we can give this additional dose, but then there was no way to capture that in the system. So now that's available. We should be able to go back and find out how many third and additional doses that we've given. That terminology is separate from a booster, which would be something that would be a recommendation that following your first two mRNA vaccines, you would get the third, you would get a booster. But the recommendation for immunocompromised is an additional dose.
Yeah. So, I mean, I think just knowing some of the numbers, some of our clinics, there's been a handful of folks coming there. Yeah. There's not large numbers. I'll say, this group of what we're calling immunocompromised, that the CDC has very specific categories that you can reference of who falls into that. The estimate is that it's about 3% of the population. So, somewhere around 4,500, 5,000 people in our county. So you would expect the numbers to be pretty small, but enough that we should be seeing some people every day coming in for that shot.
And we can't count what's happening. We will, but we don't know what's happening in our local pharmacies. We know what's happening in our clinics, but the local pharmacies is an additional place where people can get their additional dose.
Yeah, so I would just, again, encourage anyone who does meet that criteria, either if you self-identify with that and you know that you are in that group, or you spoke to your doctor and your doctor recommended it, and they themselves cannot give the vaccine, please go out and seek that additional vaccine, that third shot. It can be done through My Turn with our clinics, can be done at the local pharmacies, CVS, Walgreens, all the ones who are vaccinating, or if your medical provider does provide vaccine, they should be able to give it to you as well.
Thank you both.
Thank you, Isabella. Hank from the West Coast Outpost.
Hi. So the Public Health Division has been promoting at times these free antigen tests that are available through the state testing task force for organizations. Do you know if people have been taking the state up on that? Are organizations in Humboldt County availing themselves of those tests?
Dr. Hoffman, do you want to talk about that?
Yeah, well, I'll start with the schools who are heavily invested in this. Humboldt was one of the the early adopters of this. And in fact, last spring, we were utilizing this program before they even really had it fully ramped up. And so we designed some backups for those who were doing it around youth sports and some of the schools that were using it. So HCOE has been heavily involved in that and really helped promote that in the schools. So you've got a lot of the schools using that program. I know of a handful of businesses and organizations who are signed up and have been using it. We don't have visibility to all of them. Sometimes we find out about it because maybe they call us about a positive, or we get a positive and we find out that's how they were testing. So I think it's, there's really no reason not to utilize that program. We are, from what we're hearing, it's pretty easy to use, sign up for, there's good training. And it's a really easy way for a business or a community organization or an event to be able to test their community either one time for a single event or on an ongoing basis, whether it's a workplace that's required to test or just a workplace where you want to test folks to keep your workplace safer. So Hava, I don't know if you guys are hearing on the investigation side about any specific industries or folks who are using that program more than others.
I don't know that I could give you specifics, but I do know that my team has definitely worked with a wide variety of different places who are choosing to use that. And it's been a huge help for my team and also for our lab team at Public Health. Yeah,
we'll promote it often if we find a workplace is having a couple positives and we're working with them. We'll let them know about that program, try to promote them, encourage them to sign up for it.
It's been our understanding through reporting in the past that very few school districts actually had been using the test through the HCOE. I guess largely because of lack of school nursing staff. That school nurses are not as common as they once were, perhaps.
Yeah. So the great thing about this testing program is it does not require a medical professional. So anyone can do this. This is designed for non-medical folks to be implementing it. It's a self-collected swab, so it's minimal PPE. It can be done at a distance, so there's no exposure to the person who's observing it. And that observer who's trained through the state program, again, does not need to be a medical person at all. They just watch some trainings and learn how to run the test and how to protect themselves with minimal PPE. So it's nursing is not required whatsoever.
Great, thank you.
Okay, Ryan from Red-Headed Black Belt.
Hi. So my second question is regarding monoclonal antibody treatments. And I'm hoping Dr. Hoffman can kind of just tell us, who this treatment is intended for, how exactly does it work, and anything you want to add about maybe it's available in the near future. Thank you.
Great question, Ryan. Thanks. So monoclonal antibodies are something that can be used locally, and we're hopeful that starting in the next few days or week that we will have this local capacity for it. It's not something that's been used really at all locally throughout the pandemic. It can reduce the risk for hospitalization and death for people at higher risk. And those risk factors, they're pretty lengthy, so I'm not going to go over them in detail here, but the doctors who are referring people to this, will be aware of who fit into that risk category, but both based off of age and also pre-existing conditions like the ones I mentioned earlier, obesity, hypertension, diabetes, those sorts of things that we know predispose people. It's designed for people who are pre-hospital care, so they're mildly maybe symptomatic or asymptomatic, but with a lot of risk for potential advancement. There are some circumstances where it could be used as what we call post-exposure prophylaxis. So for someone who's not yet positive, but they had a high exposure and they're also at high risk for developing severe disease. I will note though that, when we talk about a cost benefit ratio here, this is a very labor intensive treatment, and it is not something that is going to easily be widely available. So one of the reasons it's been difficult to implement is because this requires dedicated space where a person can sit for several hours while getting this infusion of the antibody. It requires nursing staff, which we just already talked about was extraordinarily short in our county and everywhere. It requires oversight by physician staff that's also short. So there are a lot of barriers to getting this into play, and there's not an unlimited supply either. So even if we could build huge places where we could do hundreds of these a day, the supply isn't there. So it's a targeted tool that I think we will be using, and it's encouraged to use to reduce the hospital capacity and prevent in those folks who are the highest risk. But really, if we weigh what is the most beneficial and the highest really bang for our buck, it's vaccination. Those folks who are highest risk for needing monoclonal antibodies would also reduce their risk just as much, if not more, actually, by getting vaccinated. And so those same people who are unvaccinated, if they would go out and get vaccinated right now, would actually have better impact on this pandemic. It's safer. I would say, vaccination is much safer than the monoclonal antibody treatment. And it lasts much longer. We know that the monoclonal antibodies probably only give protection for maybe a few months, possibly only a few weeks. It's really geared to preventing the disease right in that moment, whereas vaccination is a long-term, much longer-term solution.
Thank you. I think you may have answered my follow-up, but if you could clarify, could you just articulate how exactly is it different from getting vaccinated for people who are confused about the difference? Thank you.
Yeah, so monoclonal antibodies are really designed to kind of go in quickly for someone who's either been infected or at super high risk for infection based on a high risk exposure, prevent them from getting really sick in that couple week time period that they would get sick in, but it doesn't last long. It's not, it doesn't stimulate the body's response to prevent disease in the future. Whereas a vaccine stimulates your own body to produce those antibodies for a long time. And, the real difference is that long-lasting immunity versus that just, short time period. So again, we're talking about a very labor-intensive, high-cost, high barrier treatment that will help people stay out of the hospital, but it's not going to last for very long versus a very easy to administer. We can do it in 15 minutes. We can do a lot of people in a day, and it's going to last for a really long time. The cost is way less. And those are the main differences between those two treatments.
Thank you so much. Very clear. I appreciate it.
Thank you, Ryan, and to all of our media representatives and to our panelists. I appreciate you joining us. I'll get the recording out to media as soon as possible. Have a great day, everyone.